Hello, everyone. Good evening, and you're welcome to my page. Welcome to Blissful Life. My name is Priska. Today, we're going to talk about miscarriage, the causes of miscarriage, the risk of having miscarriage, and the prevention of miscarriage. So, before I step forward, before I go further, what is miscarriage? A miscarriage is a loss of pregnancy before 20 weeks of gestation. Most miscarriages happen during the first trimester. All right. It is nobody's fault. It is not your fault if you miscarry a baby. It is nobody's fault most of the times. Sometimes the baby just decide not to grow any further. And when a fetus stops developing, what happens? The body just decides to take it off, take it away, eject it, anyhow you would want to put it. Now, what are the causes of miscarriage, or what could put you at a very high risk of having miscarriages? According to research, it said that women who are 35 years and above are at a very high risk of having miscarriages than women who are younger. Then there are some certain medications that when you're pregnant, you should run very, very far away from them. This group of medications called NSAIDs, non-steroidal anti-inflammatory medications like ibuprofen. Because I could remember when I was pregnant with my first child, although I'm a nurse, I know, but when I started going for antenatal, I was told to stay very far away from this medication. That even if you have headache, even if you have pain, you're supposed to take paracetamol. In fact, not even any type of paracetamol, Panadol extra, like the softest type of paracetamol. And another cause of miscarriage, or another thing that could pose you at a high risk of having miscarriage, is infections. There's this rubella infection, and then there is sexually transmitted diseases like the syphilis, gonorrhea, chlamydia. If you have them without proper treatment, that child is going off. Again, some certain lifestyle like drinking alcohol when you're pregnant, smoking, and doing drugs, drugs, yeah. Any type of drugs, any form of illicit drugs when you're pregnant, you are posing the child at a risk of miscarriage. Then there is something called incompetent cervix. If a woman has incompetent cervix, there's a high chance that that baby is going off. When a woman is pregnant, the cervix tends to, not the cervix tends to close. When a woman gets pregnant, the cervix closes. And the cervix remains closed until the baby is ready to be born. But in the case of incompetent cervix, it opens earlier. It opens earlier in pregnancy. And when it opens, the body is seeing it as, okay, you want me to bring out this baby. And what happens? The body tries to bring out the baby, causing miscarriage. Also, if you have uncontrolled diabetes when you're pregnant and you have uncontrolled or high blood pressure during pregnancy, there's also a high risk that you may miscarry the baby. Also, hormonal imbalances. There are some, when you're pregnant, all the hormones are supposed to be balanced just to help the baby to grow. But when there is imbalance in one form of the other, there could be a high risk. There could be a possibility that the pregnancy is going off. Again, if you have fibroids, the issue with fibroids and all that, most times fibroid makes it difficult for someone to get pregnant. And even if you get pregnant, it pushes the child away. So fibroid is also another factor that could cause miscarriage. And then there's a particular fruit. I don't know if this one is meat, but I've had it a lot of times, and I've also how will I put it? Experienced it. You see, pineapple. I really don't know what is inside pineapple. I don't know what it's made of, but if you're pregnant and you take pineapple, there's a tendency, or if it's not like if you take it once, but if you're pregnant and you start taking pineapple, there is a high possibility that that pregnancy is going off. Pineapple has this chemical that tends to scatter everything in your cervix, opens it, and then everything in your uterus will just pour out. Yes. And also, another cause of miscarriage could be improper implantation. When the egg fertilizes, it goes to the uterus and stays where it develops till you give birth. But if there is improper implantation, instead of the fertilized egg to go to the uterus and stay and develop, it goes somewhere else. Probably goes to the ovaries, somewhere else and stay. It could cause miscarriage. Having said that, let us talk about the symptoms, how you would know that you are having a miscarriage. First of all, there is bleeding. It starts with spotting. You will notice some spotting, drops of blood on your pants, and then from spotting, it generates to bleeding that goes from light to heavy. From spotting till you have a full bleeding, which lasts for about 7 to 10 days. And then there's also abdominal pain and cramps. This one is higher. This one is more painful than menstrual pain. It hits you so hard. And then there's also lower back pain. Hot compress cannot stop this one. So when you start feeling that type of things when you're pregnant, just run to the hospital and know that that child is not safe. Again, when you are having miscarriage, there's also a reduced symptom of pregnancy. You see the early morning sickness, the early morning sickness, the vomiting, the nausea, it starts to reduce. You start feeling that it's reducing. So once this type of things kick in, kindly go to your healthcare provider and make a complaint. Again, when someone has a miscarriage, see, it is no one's fault when there's a miscarriage. It is nobody's fault when a miscarriage happens. It's like I said earlier in the video, it could happen to anyone. It could happen at any time. It could just be spontaneous. It can just happen. All right. So once you notice that you've had a miscarriage, first of all, after reporting to the doctor, they would check you. And if there is still some blood left, there are some methods to take it out. First of all, could be D&C, the dilatation and curettage, where they take you into the theater, scrape out the bad blood. Not everyone like this process. While some people like doing it the traditional way, they cook some herbs and they drink it. It helps to wash out their system, like the ajun bise. A lot of people believe in the ajun bise, so they cook it for a period of a few days and drink to help wash out the uterus. Some women tend to use a hot bath, using hot towel to massage the stomach area, the uterus area, the back of the waist, just the waist, and then they massage it very well, just so that the bad bloods will come out. Then after the bad bloods are out, the next thing you have to do is to go for an ultrasound to be sure, to be doubly sure that this bad blood is out. Once you are sure that it's out, you start taking very good care of yourself. You relax emotionally. You try to recover emotionally and psychologically, because having a miscarriage, like especially for women who wants this baby, especially for women who has been longing to have their own child, and then suddenly you have a miscarriage, is disheartening. It can just scatter you. But what you do is, when you recover, when you know that all the bad blood is out, you take a chill pill. You try to recover. You try to be yourself again. All right. Having said that, let's dive into the prevention of miscarriage. It cannot be overemphasized. Having a healthy lifestyle, eating healthy food, stay away from caffeine. You see, coffee. When you're pregnant, you stay away from caffeine. Honestly, yes. And then when you're pregnant, you try to attend your antenatal appointments, and also make sure to take your prenatal vitamins like the folic acid, the B complex, the fesolates, even pregnant care is also good. You take all those medications to help you be in good health and also help the baby to grow as well. And also stay away from alcohol, and stay away from smoke and drugs. Having said all this, I believe that this video is going to be helpful to you. So if you find it helpful, help me like and share this video. And thank you so much. See you in my next video. Bye.